How long it would take for dental implant to heal? One thing is depending on the site. On the upper jaw, generally speaking, about 6 months, and because bone is more spongy and softer, and the lower jaw is about 2 or 3 months because more is more dense. But assuming the bone is intact, if a patient needs bone grafting, for example, to create that adequate length or adequate width, so it may take longer before you can use the implant for the bridge or crown or what have you. One thing is there are some limiting factors. For example, in upper jaw, the proximity of a sinus, location of a sinus is an issue. Many people have lost the teeth in the back area, molar area. So as a result, the bone has been resolved and the sinus has been kind of coming down. So because of a proximity, we do not have adequate bone to place the implant in that side. In those cases, we do what we call a sinus lift or sinus augmentation. Keep in mind, sinus is like a hollow space, like an egg. And you cannot just put an implant in an empty space. So what we do, we push the floor of a sinus up, we put a bone there, the bone grafting, and then that would provide adequate bone to place the implant. This is what's called sinus lift or sinus augmentation. And sometimes the option is using a short implant instead of touching the sinus. As long as we have adequate, maybe 8 millimeter or even some cases 6 millimeter of bone, we can put a shorter implant without that sinus lift or sinus augmentation. The important thing is if you put a shorter implant, then you have to increase the number of implants because the amount of load and pressure which is applied, you are distributing on, for example, 3 short implants rather than 1 or 2 short implants. So when the implants are shorter, you have to increase the number to distribute the load and the pressure.